Hello, have you been diagnosed with breast cancer or do you want to know more about breast cancer? I am Harun Thomas, consultant oncoplastic breast surgeon, and I, along with my team members, have created this video about the treatment options available for someone diagnosed with breast cancer.
When it comes to treatment options for breast cancer, we take what is known as a multidisciplinary team (MDT) approach, with input from the oncologist, the pathologist, the radiologist, the breast surgeon, and the breast care nurse. Patients with invasive breast cancer will usually be recommended surgery to the breast and to the armpit lymph nodes. Surgery to the breast can be a wide local excision or a mastectomy. A mastectomy is a type of surgery in which the whole breast is removed. A mastectomy might be recommended for various reasons, but not limited to having a large tumor relative to your breast, if you are unable to have radiotherapy, or if you have a gene mutation which increases your chances of having a second cancer. There are various types of mastectomies available, and your surgeon will go through your options to find out what is best suited for you. After a mastectomy, some people might choose to have a reconstructive surgery to restore the appearance of the breast. If you are having a reconstructive surgery, this can be done at the same time as your mastectomy or sometime later. It is always a good idea to discuss whether or not you would like to have reconstructive surgery with your surgeon, so that the breast surgeon and the plastic surgeon can come up with the right treatment options for you. It is important to note that some women choose to not have reconstructive surgery after having a mastectomy. A mastectomy is carried out under general anesthetic, which means that you'll be asleep throughout. During the operation, a cut will be made across the breast and the tissue will be removed. Most people are able to go home the same day or the next day after they've had a mastectomy, although if you've had a reconstructive surgery, you might be in hospital for some time longer. It might take about 3 to 4 weeks for your stitches to heal, and during this time, you might feel sore and have some swelling around the stitches. Please watch our video on mastectomies for more information about the surgery and its potential complications. Wide local excision. Another type of surgery is known as a wide local excision, WLE. This is a type of breast-conserving surgery in which the cancer is removed with a healthy rim of normal tissue around it. You may be able to have a wide local excision, also known as a lumpectomy, if the tumor is not too large relative to the size of the breast. There are other factors that will be taken into consideration, such as where the cancer is in the breast and whether or not there is more than one area of cancer in the breast. A wide local excision is performed under general anesthetic, so you'll be asleep throughout the operation. To find out more about wide local excisions, please check out our other video. The link is down below. Another treatment for breast cancer is radiotherapy. Radiotherapy involves the use of high-energy X-rays to kill the cancer cells. Radiation therapy works by killing cancer cells or slowing their growth by destroying their DNA, which means that they are no longer able to divide, and then they die. The body then removes the dead cancer cells. Radiation therapy is usually given after surgery or chemotherapy to help to remove any remaining cancer cells in the breast. There are different types of radiation therapy that you might be offered. Breast radiotherapy. After breast-conserving surgery, radiotherapy is applied to the whole of the remaining breast tissue. Chest wall radiotherapy. After a mastectomy, radiation is applied to the chest wall. Breast boost. Some women may be offered a high dose of radiotherapy in the area where the cancer was removed. However, this might have an effect on the appearance of the breast, particularly if you have large breasts, and might cause other issues such as hardening of the breast, known as fibrosis. Radiotherapy to the lymph nodes. Radiotherapy may be targeted towards the armpit and surrounding areas to kill any cancer cells in the lymph nodes there. Intraoperative radiotherapy. There is some research to show that radiotherapy given during an operation can have the same effect as conventional radiotherapy, which is given after an operation. However, this is only available at a few centres. Radiotherapy is a targeted therapy, which means that you'll have a planning appointment to determine exactly where you'll need the radiotherapy and how much you will need. During the appointment, you'll usually have a CT scan to allow the team to be able to visualise the area. Each person has an individualised radiotherapy plan. The scan only takes a few minutes, but you'll need to be as still as possible to allow the radiographers to take the best images possible and help to guide your treatment. The radiographers will be in a different room whilst you're having your scan, but will be able to see and hear you, so please let them know if you have any concerns. The radiographers will then make pinpoint tattoo-sized marks on your skin to ensure that you're receiving the radiotherapy in the exact same place every time. The radiographers might also make a mold for you, also known as a shell. The shell is worn during your radiotherapy sessions to ensure that your breasts stay in the same position each time. You will have your radiotherapy sessions during the week with a break at the weekends. It is usually given for 1 to 3 weeks. Treatment sessions only last a few minutes long and you won't feel anything during the session. You will be asked to lie still, and occasionally you may be asked to hold your breath for a few seconds. The machine will rotate around you, which allows it to give you treatment from different angles, so at no point will the machine be touching you. It is important to note that despite having radiotherapy treatment, you yourself will not be radioactive, which means that you can be around other people, including children and pregnant women. Side effects of radiotherapy vary from person to person. Some common possible side effects include irritation and darkening of the skin around the breasts, tiredness, difficulties moving your arm, loss of hair in the armpit, or build-up of lymphatic fluid in the armpit, also known as lymphedema. If you are experiencing any side effects, please let your doctor or your breast care nurse know so they can support you through this time. Chemotherapy is a type of treatment which uses drugs to treat cancer cells. Chemotherapy circulates through your body through the bloodstream, which means that it can kill cancer cells anywhere in the body. Chemotherapy can be given before surgery to help to shrink the size of the tumour. If it is done this way, it is known as neoadjuvant therapy. You can also have chemotherapy after the operation to help to kill any remaining cancer cells. If it is done in this way, it is known as adjuvant therapy. When having chemotherapy, it is usually done in cycles of treatment, which means that your body has a chance to recover in between each cycle. Different medications can be given during chemotherapy, and at times, 2 or more can be given at the same time. Your oncologist will speak to you about the type of chemotherapy that you can have, as this can depend on the type of cancer you have and whether or not it has spread in your body. Chemotherapy can either be given as tablets, which you can take at home, or through a drip into your vein. If you are having chemotherapy through the vein, it is usually as an outpatient, which means that you do not have to stay in hospital. There are some associated side effects with chemotherapy. Some common side effects include hair loss, loss of appetite or weight changes, diarrhea, fatigue, hot flushes or vaginal dryness, nerve damage, mouth sores, increased chances of infections, easy bleeding or bruising. For younger women, changes in menstrual periods can also be a common side effect of chemotherapy. Premature menopause or infertility can also occur, and there is a chance that this is permanent. If you think that you may want to have children, please speak to your doctor before your treatment begins. Another form of treatment for breast cancer is hormonal treatment. Some breast cancers have receptors on their cells, which means that the cancers can grow in the presence of certain hormones. These type of cancers are known as receptor-positive breast cancers. Hormones are naturally occurring in the body. Before menopause, the ovaries produce the hormones estrogen and progesterone. Your oncologist will do tests to find out if your cancer has hormone receptors and then to find out the type of hormone receptors. This is because hormonal therapy can help to shrink breast cancers. You can have hormonal therapy in addition to surgery. If you have hormonal therapy before the surgery, this is known as neoadjuvant therapy. This can help to shrink the cancer before the surgery. If you have hormonal treatment after surgery, this is known as adjuvant therapy and is the most common type of way of using hormonal therapies. The aim of the treatment is to lower the risk of the cancer returning. You can have hormonal therapy for 5 years or more, but the exact time frame will depend on your individual situation. Some side effects of hormonal therapies include hot flashes or sweating, changes to your period, vaginal dryness or discharge, nausea, fatigue, mood changes, or loss of interest in sex. Please tell your doctor or your nurse if you're experiencing any of these side effects, as they can help to support you with this. If the breast cancer cells contain specific proteins like HER2, your oncologist will recommend specific medications to help against these targets. You may be advised to have these before or after surgery. Currently, medications to modulate the immune system is recommended in certain advanced and metastatic cancers. To conclude, patients with breast cancer will most likely need multiple methods of treatment which all work together to bring about an overall good outcome. Thank you for watching this video, and I hope that you found it useful.
Thank you for watching our video. I hope that you found it useful.
Thank you for watching
Please feel free to like, comment and subscribe to this channel,
and watch the other videos in this series.
and to share it with people that you might think might benefit from this information.